Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today, we have a very special guest with us. I think all of you must have recognized him by now. We have Dr. Rafi Aibani from Random and More, who is a graduate of Dow Medical College. It's such an honor for me to have him here today with us because I've been watching his videos from my MCAT time and from A levels and have followed his journey through Dow. And now he has matched into internal medicine residency in the US. I'm very honored to have him here today with us. Thank you so much for joining us, Dr. Rafi.
Yes. Thank you so much for that introduction. I just love what you're doing. To see a fellow Dawite, being on YouTube as well. It's good to see, and I love what you're doing. Keep it up.
Thank you so much. We usually start by talking about early life and what was your early education like? Where were you born and raised? And how did you decide that you want to become a doctor?
I don't think I've ever properly discussed this on my YouTube channel, or my close friends know about this. So I was born and raised in Japan. My mother is half Japanese and my father is Pakistani. So I don't think that's ever been put out. So I was born and raised in Japan. My early education was in Japan. And I grew up in Japan until the age of 14. And then at the age of 14, I came to the UAE, where I lived there for 2 years. And then in grade 9, I came to Pakistan. And then I got into Dow. I did my O-levels, A-levels in Pakistan. And then I got into Dow. I, graduated from Dow 2021, sat for the match, and then I'm here. So this is a little bit of my upbringing. How did I decide to become a doctor? So as growing up, I was always a clueless kid. I'm the first doctor in my immediate family. My parents aren't doctors. I don't have cousins who are doctors. I don't have siblings who are doctors. But then my dad, he's like, "Oh, Rafi, you're good at studying." I wasn't really good at studying when I was in Japan. I came to Karachi, and then my academic trajectory, it went up suddenly. I think it's because of the competition and then comparison with your cousins. So then that's how I guess I got better at studying, and then I somehow ended up doing good in O-levels and A-levels. I had good enough marks. So my dad's like, "Rafi, why don't you become a doctor?" At that time, I wanted to become a pilot. I liked traveling. So I'm like, I want to become a pilot. But then they were like, these how they see parents are. They're like, "No, that's not realistic. That's not possible." So they're like, "Become a doctor." So it was like it's the typical. I feel like this is a story of many these people from the subcontinent. You just have to, don't play victim to that. "Oh, this is not my choice." You just gotta make the most of whatever situation you're in. And I think I did that. Just worked hard with whatever I was in, and yeah, I'm here today.
I think a lot of Pakistani students go through this. If they're good at studying, their parents expect them to do medicine.
Yeah, I just think in Pakistan there's just a lack of options. It's like, it's like when I was going through O-levels, A-levels, my parents didn't want to send me abroad. They wanted me to be around them. So I just had to consider my options here, and medicine was something I saw, okay, it's possible. But then apart from medicine, there aren't many options, like practical options where you could pave a path. So, but then within medicine, it's very established. So, yeah.
I think in Pakistan, that's a very big issue. If you don't want to go abroad, then you have very limited options. It's either engineering or medicine or business or maybe social sciences.
Yeah. At the end of the day, I'm just happy where I am. You can't live with regrets. Whatever you decide to do, you just gotta try your best. So I'm glad. I'm content.
What was your experience at Dow like? Because I know that you're a senior and we watched your vlogs. Even before coming to Dow, when we got in, we used to watch all of your vlogs and see what it's like. Things were very new for us. You mentioned void tests in your vlogs, and at that time we were clueless. We didn't even know what void tests are. What was that experience like? What was Dow like for you?
Honestly, Dow, I think, and overall, looking back now that I've graduated, I think it was an amazing experience. The biggest compliment I've received, while starting this YouTube channel, and everything, is that as a junior, they came up to me, me and our group of friends who are in the vlog as well. They were like, "What we see on video is exactly how you are in real life." So that was the best compliment I've received. And overall, I truly enjoyed Dow in the sense that I met some great people, made some, I hope, lifelong friends. So it's just overall good people, good supportive environment. I just love the how Dao, the smartest of the smartest gets into Dao. So for some people, it depends on who you are and how you take things. Some people might be like, oh no, it's too competitive, it's too toxic. I believe that pressure makes diamond. I thrive under pressure. So, just seeing such ambitious, hardworking people and being surrounded by them pushed me to become the best version of myself. So I'm just very grateful for the opportunity and everything Dao has done for me to allow me to be where I am today.
I think what you mentioned right now, it's very true because one of my friends from another university in Lahore, she was telling me that, whenever I open any Dow student's Twitter account, all of them are doing something. Either they're in an organization or they have some startup or they're doing research or they're doing something. All of them are doing something. So I think that environment really pushes you to do better. But for some people, it does get a little overwhelming.
I think it's like you just have to absorb all that pressure and have a positive output. It could go bad both ways, either you get depressed and you get sad and you just crumble under pressure, or you could become the best version of yourself. So definitely, I know it's easier said than done, but you should try to take that in and try to come out better, I feel.
And I think Dow also has a lot of clinical exposure when it comes to the kind of patients that are coming in. I just started my clinical rotations, and the kind of cases that we see, it's very painful at times to see patients in those conditions, but then you also get to learn a lot. So I think it's an overall nice experience.
For sure, for sure.
When did you start Random and More, and what was the thought behind it?
That's an interesting story. So I think in order to tell this story, I have to go back to my MCAT phase. And as someone who, as someone who has gone through the MCAT phase, I'm sure you can relate when I say this, that it is probably one of the worst year of our lives, right? It was probably one of the worst year of my life, and it was just very, very bad. And I think back then YouTube was banned. So YouTube was banned coming in, and at that time, I'm not sure if you know of the YouTuber Casey Neistat. So back then he was at his peak, and he used to upload daily vlogs every single day. And while I was studying for the MCAT, those sin textbooks, which were extremely boring without any color, it was horrible for me. And every single day, the only thing I looked forward to were those vlogs. So his vlogs is not necessarily medical related, but I used to watch his vlogs every single day. So that initially ignited my passion of, okay, I'm consuming content. What if I'm on the other side of the camera and I'm producing something? So that was like, it clicked in my head. And then I got into DAO, and as you can, and I'm sure you can relate when I say this, it's not a big place. There are not many things to do apart from studying and just eating food and talking to your friends. And that gets boring after 6 months. That definitely was the case for me after 6 months. So and another thing is that whilst going through the MCAT, YouTube at that time was banned, and there wasn't that much awareness and guidance on how to get into medical school. So like I said earlier, I'm the first one going through this whole process. I had no idea what to do. I was reaching out to seniors, but the success rate of getting a reply is very, very low. There were some seniors who did help me out, but that was very low. So when I got in, I was like, okay, I have this passion for video making, and I have this problem where there isn't much awareness regarding MCAT. So if I combine the two, I could do something productive as well as not be bored and out. That was the initial thought process. And then I found a few friends who were ready to do it. And all of us, we started this thing. And I think, yeah.
Our MCAT year was 2020, the COVID year, and we had around 7 to 8 months for preparing for the MCAT, and we were at home. So I remember watching all the Random and More videos during my breaks and just seeing what it's like. All the MCAT guidance videos as well. What I really like about the videos was that they were very casual and very informative at the same time.
So we try to make sure that, okay, we are being casual in the vlog, but in order to not waste the other person's 10-15 minutes, they're taking 15 minutes of their lives to watch us. So we're like, okay, we'll try to make it funny, and we'll also try to put in some life lessons or whatever, just work hard and stuff, something motivating. So to hear that you also found benefit from it, I'm just really glad. Everything worked out. That was the purpose.
That's amazing. When you were at Dow, what was your educational experience like? Because I believe that there are a lot of changes that need to be done in the undergraduate curriculum in Pakistan, especially. What do you think are some of the changes that you would like to see in medical colleges in Pakistan, especially government institutions?
Yeah, this if I start on this, I could go on for an hour. I used to complain about this all the time to my friends. One thing which I really don't like about the whole education system is I just feel it's a bit outdated in the sense that you go there and the professors they're just going through their PowerPoint slides, and as a student I really didn't gain much of it. And I believe that once you get into medical school, all the students there, they're at a certain level of maturity and education. Like they're smart enough to study on their own and to be motivated. I think COVID year has definitely taught us. If you got admission into Dow, I'm sure you didn't experience this, but while when it was COVID, I was in my 4th year of medical school, and Dow approached this hybrid model where classes were all virtual. So all the PowerPoint slides and everything were done online, and we only had to go to Dow for clinical wards. So that made me realize, okay, so I don't necessarily have to be there to go through the lecture slides. I could self-study at my own pace, at my own my own timing. I feel what should be done to keep it short is basically, I think that the basic classes, I feel that should be all abolished. There are good enough resources available online, like Boards and Beyond, Pathoma. There's so many amazing resources online. We should only go to medical school for clinical rotations. I'm not sure if this is a popular idea, but I just feel that this is something I would like. I believe that I would definitely be a better student if I study on my own, if I explain things on my own, and then go to professors with specific questions I have, instead of yeah.
I think that is a very popular opinion now, because all of my friends and all of my colleagues, I think 90% of people would agree to this, because even during the classes at Tao right now, most of my friends are watching Sketchy or Boards and Beyond or Pathoma on their laptops, and they're not really listening to the professor. And I think that's a huge waste of time for the professor, for the students, because this could be done in a more productive way, where obviously the flipped classroom method is being talked about a lot nowadays, where you just do the studying on your own and then you ask questions or have interactive sessions with the teacher.
I feel like this another problem this creates is for those students who like being taught this way, because of students like me who don't like this method, we end up disturbing them and they end up losing their time as well. So I'm just like, it's not a win-win for anyone. The professors don't like teaching unmotivated students, and so it's just like, I feel like this could be so much better, where if we could just all go to if we could just go to the hospital from 1st year of medical school for 6 months, maybe teach us the basic etiquettes of how to approach a patient, how to talk to patients, the language and everything, and then we study on our own. Just provide us subscriptions to these video resources. I feel like that's the best way. I think that's how it should be.
What do you think is the reason for not changing this? Because this conversation, I think, has been going on for a lot of years now, and most of the medical students agree to this. But whenever we approach the principal or administration of our medical schools, they're not ready to accept the changing situations and the changing dynamics. What do you think is the problem over here?
I just think change is always something scary. Change makes people uncomfortable. It's definitely and I think the people who are in administration and people who are at the top, they have been taught and they have been groomed a certain way. They have gone through the traditional method of teaching, which I'm not saying is not a bad way. It's just that back then the Sketchy, Boards and Beyond, Pathoma were not available. The only way of obtaining the information were from professors. So back then, I feel like the times were different. Currently, there's an information overload, so we could be very selective with how things are. So I feel that maybe if we, if our generation become the dean and become the principal of medical schools, hopefully by then we could implement these changes, because definitely the people who are running these things are not very receptive to change for their reasons. And yeah, so I feel if we could hopefully start changing things, maybe one day.
Hopefully in the future, inshallah, I hope that people from our generation do bring change.
Yes.
When we're talking about classes and boards and medical school, there's obviously this concept of burnout. So how did you tackle that, and what advice do you have for medical students who are going through this phase right now?
Yeah, you're definitely right. I believe that I can't say that I'm a master of preventing burnout and everything, but I've definitely faced burnout. I think in my third year of medical school, when rotation started, and then I had random and more, and then back then I also wanted to get into USMLE. I also had to focus on research. So just balancing all of that whilst maintaining attendance, I live 1 hour away from the hospital. I live 1 hour away from Dow. So just the commute every day takes 2 hours. So yeah, so it's just a lot on my plate. But I believe what truly helped me was just having a life outside medicine as well. So I believe that Random and More, it was very therapeutic for me in the sense that it gave me an escape from medicine. So what I didn't want for myself was, going to medical school for like 5-6 hours and then studying after, to working on research projects. And then if that's my life, I would be miserable. I feel like that would have definitely forced me to become burnout much rapidly. But whereas Random and More and making vlogs, having this creative outlet allowed me to divert my mind from this. Along with that, I was always a part of the Dow football team. I'm not sure if that team exists anymore. And we were participating in every tournament. And I believe that just having a life outside medicine truly helped me out. So I believe that this is something I would recommend. Don't make medicine your whole life.
This is a problem we face when we come into first year of med school, because we hear a lot that, when you get into medicine, you're going to study for the entire day and you'll have to miss out on plans, you'll have to miss out on family gatherings and dinners and events. But I think that personally, I've experienced this and I'm still learning. But I think that if there's a place that you have to go to with your family or your friends and you feel like this is going to refresh your mind, then you should go. Like 2-3 hours of going out or doing something that you really like, it's not going to change your entire study situation. It's just going to make
For
it
sure.
better.
Yeah, and it's only gonna refresh you, I think. Yeah.
You mentioned that you started preparing for your USMLE exams. First of all, I'd like to congratulate you for matching into internal medicine. I think it's an amazing achievement.
Thank you.
When
Yeah.
did you start preparing for the USMLE exams? A rough timeline of your journey, if you would be comfortable sharing that, because I think a lot of people who want to go on this journey are very confused about when to take the step 1, the step 2.
So when I was in my first I think back then there were like 3 options which were commonly available for medical students. So there's USMLE, you go to the United States. There's PLAB, you go to the UK, and then there's FCPS, you stay in Pakistan. So those were like the 3 routes. So I didn't have that much awareness. I'm just like, okay, which yields the best? Like, what is the best thing I could do for myself? And after consulting a few seniors, they're like, oh, okay, if you want to, you should do USMLE. These are the pros and cons. It's costly. It requires a lot of hard work. And I'm like, okay, I like to work hard. I think I could do it. So then, so like in the first 2 years of medical school, I was deciding, what I want to do. And then in third year of medical school, I bought my first copy of the First Aid. I think it was First Aid 2018 back then. I bought my first copy, and I started implementing USMLE books from third year of medical school. So back then, we had the semester system, semester modular system. I think it's the annual system right now, so it's a little bit different. So I used to use the USMLE books, which were First Aid, Path Aid, Golian, Sketchy. I used to use these textbooks along with the books required for Dow. But I predominantly use the USMLE books, and I use those books to pass every single module. Yes. So that was my journey. And third year happened, fourth year happened, final year happened, and then back then USMLE step 1 was in the score. You had to give it in a score. So that required a prolonged period of studying, because managing your Dow exams and then managing USMLE, it gets a bit hard. So you can't really do everything all at once. And then in September of 2021, I graduated in April. September of 2021, I gave my step 1. In June of 2022, I gave my step 2. And then I sat for the match in September 28th. That's the deadline of the match season. That's when you submit everything. And then April 2023, yeah, I'm here now. So that is a rough estimate of my journey.
That's really nice. I feel like you took the step exams very close to each other. And that's what a lot of people say, that because once you're done with step 1, it's mostly the same foundation that you're building on with step 2 as well. So it's better if you take the exams closer to each other. What was your match experience like and the match journey? And what were some of the hurdles that you faced during that journey, and how did you tackle them?
I feel the biggest hurdle for me was finding rotations. It's definitely not easy. It's not easy. So COVID just finished, and because of COVID, our batch couldn't go for electives. So electives were out of the question. So I don't know how that goes about. And then final year, I gave my step one, and then I was reaching out, sending emails to many doctors. Like once I finish a block of UWorld, I would be sending emails. But getting success out of emails, getting emails is very hard. I'm sure there are success stories, but at least for me, they were very it was not, I was unsuccessful. So then I realized that I have to change my angle, I have to change my perspective. And like we discussed a little bit earlier, they see parents, they have this thing where they want us to become doctors, and this is so I realized I could take this advantage. So I reached out to my dad. I asked my dad, I'm like, I'm sending emails, but it's not working. You all like, don't you have any doctor friends? And my dad, he just started reaching out to his old friends. I yielded success from that. So I think I got lucky in that sense. I found a doctor who was willing to allow me to rotate with him. And that, I feel that was the biggest hurdle. Finding rotations was the biggest hurdle for me. Yeah, but it worked out at the end. Along with that, and it's just that another difficult thing with this whole journey is you take so long to study for step one, you take so long to study for step two, and you can never have a moment of, you can't truly be happy and celebrate that, oh, you're done with step one. The moment you're done with step one, you have to start thinking about step two. The moment you're done with step two, you have to start thinking, okay, do I have enough research? Do you have enough extracurricular activities? Do you have rotations? Do you have LORs? So the most difficult thing is just being consistent, being motivated enough. I believe that we say that motivation is very important, but I don't believe in motivation. It's just that you have to, like, I was in a mindset that I was truly robotic. I was just like, okay, these are things I have to do. I can't bring my emotions into this. How I'm feeling doesn't matter, because the earth is going to move on. It's not going to stop for me. I'm feeling unmotivated. So it's just being consistent and, yeah, so I feel that was the most difficult part of the journey, but alhamdulillah, it all worked out. So I'm just really glad. But that was definitely very hard, just being motivated the whole time.
I think that is the case for the USMLE journey, and that is why a lot of people really put in a lot of thought before going on this path, because there's long-term commitment. It's not just 1 year or 2 years, it's almost throughout med school.
I believe that like talking on this rotation thing, so like the thing is, in order to sit for the match and in order to have a complete profile, having US clinical rotations is mandatory. Like it's you should have it. Obviously, there are candidates who are successful without it, but there is no streamlined process to make it to facilitate students. I feel like that's a flaw in the system. I believe that that is where things could get better, because it's a requirement. We need LORs from US doctors, but obtaining those LORs, finding those rotations is very hard. So I believe that if it's a requirement and we have to do it, so in the middle there has to be a way to facilitate all of this without being exploited, because I feel like medical students, IMGs especially, there are clinics and rotations which try to exploit us, because we need it and it's not available, so it's very easily exploitable.
I've heard that from a lot of seniors as well. I hope that it works out for everyone. What are your thoughts on research? The program directors, when you interviewed, did they look into the kind of research that you had?
When I applied for the match, I only had 2 publications, and for DAO, that is for DAO student, I feel like it's relatively on the lower end. And I did when I think I had my first publication in second year of medical school. I took part in RCOP, and then I learned the basics of research, and then I got 2 publications. I got busy with Random and More, and I'm like, oh no, I enjoy Random and More instead of research. If I have spare time, make videos, not research. So that was my mindset. And I believe that and it worked out at the end, so it didn't really matter. I believe that doing research for the sake of just publishing, just for quantity's sake, I feel like it's useless. Then it's not good. But I feel research for the sake, for quality, building connections. I feel research, you shouldn't do research just to say that you have 50 research or you have 20 research. You should do meaningful research. You should know what you're writing. You should know what you're talking about, what you're writing. And I feel like research is definitely very effective, and I encourage all USME applicants to do research. But know why you're doing it. You should do it to build connections with doctors. It's a good way to build connections. It's a good way to increase your knowledge. It's a good thing on your CV as well. But during the interviews, we had discussions on our research. One program director said you have quite a, and she said that for my two. So back then I was really, really happy. So I realized that in the long run, doing nothing is not having zero is definitely not good. If you could do 100, if you could do 10, 20, 30, that is amazing as well. But don't feel under pressure if you only have 2, 3. It works out at the end. If it works out for me, it would work out for everyone.
I feel that you shouldn't do research just for the sake of, as you said, increasing your publication count. Because the program directors will also understand, they are very experienced and they'll know what kind of work you put into that paper. If you don't really know how to explain your paper in an interview. So I think having 2 or 3 is better rather than having 10 and not knowing what you've done in most of the
Exactly. Do it for the right reasons, I believe. It's a very effective tool to build connections, and it definitely would do you more good than harm. But as long as you do it right, you know why you're doing it, and your intent is good. Intent is very important.
That's true. So you mentioned building connections, and I feel that we hear this a lot from all of our seniors that you should build connections and you should have a mentor. But how do we build connections?
I wouldn't say that I had much of a success building connection for sure, because I feel like I wasn't aware of this awareness, which is connection is very, very important. Like I didn't know that okay, you should know people, but I didn't put much effort into it. So that's where I lacked a little bit. But if I were to advise somebody else on how to go about this building connection and stuff, I would say that you shouldn't be nice to someone because you want something. I feel at the end of number one, it's very important to have the right intention of why you're talking to someone. You should be very your intention should be right. You should be a good human being to everyone, regardless of who is who in what position. So I feel number one, because the people on the other side, they could read your intentions. They're very experienced. They've spoken to many people, so they can judge character very easily, right? So that's very important. You shouldn't respect someone because somebody is in a respectable position. That's one thing. Number two, you should be very good in your language, the way you approach your seniors. I feel that is very, very important. Seniors, residents, attendings, they have a lot going on and they get thousands of messages. So, having proper grammar, having professional writing style. They're not your friends, they're not your buddies. So you have to approach them very respectfully, very professionally. Be aware that they won't be able to reply on time all the time. If you were to ask me, that we could cover that. How should we go about connections is go see where residents matched. And residents are always looking to publish case reports. They want publications as well. So if you are approaching them, you should explain that, okay, you are oriented to USMLE, you have this much free time, and you have this much prior research experience. If there's any future projects, could you please let me know and I could help you out. So I feel that this is something I didn't do personally, but I believe that this is something I should have done earlier. So this is something I would advise to my juniors in medical school who are approaching this thing. Yeah, so I feel like that is the most effective way of building mentors. And but that being said, because I've rotated with the medical school, it's also very important to maintain relationship. Just because you've matched and just because you got interviews, just because things worked out for you, does not mean you forget them as well. You have to constantly update them. Like they helped you out, so you owe it to them that they should at least know what's going on in your life. It shouldn't be the case that your work is done so you forget them. So I feel that is very, very important.
What was the interview period like? When did you start receiving interviews? And what do you think was one thing that made you stand out during your interviews and you talked about more?
I started receiving mid-October, end of October to November. That's when I received like most of my interviews. And then what was the interview season like? I practice a lot of interviews. I practice a lot. So some people, they're like, oh no, Rafi, you make YouTube videos, must be easy for you. But I believe that taking an interview is a different art form. Yeah. Because what you have to understand is, number one, it's a very crucial process to get a job. Your whole everything you've worked for comes down to the 15-20 minutes you work with a doctor. So you have to make an impact and you have to sell the best version of yourself. It's an elevator pitch where you have to sell yourself in 15 minutes. You got to make sure you do it right. So the first week of October, I had amazing mentors who helped me out in this regard. I scripted my answers, I wrote it down, and then I had amazing friends who had the same work ethic as me. And we used to practice every single day, like 5 hours nonstop. We would critique each other's answer. And we had a list of documents where we were going through every single questions. And we were just, self-critiquing each other. And I did that very well. I did that most of the time until I memorized his answers and he memorized my answers. That was the case with us. So we did that much practice. And along with that, I had to travel back and forth because for my step 3, I was also studying for my step 3. I was working on a few research projects. So it was just very, very hectic. These couple of months, it's very anxiety inducing. Because if you're not getting interviews, you're worried, you're checking Twitter, you're worried about everything, you're always tense. And on top of that, you got to practice for your interviews because in case you get an interview, you got to be ready at all times. So it was just very, very hectic. But, I'm just very glad that I had a good group of people around me who were very dedicated, very ambitious, and we were very strategic with our approach, and it all worked out, I guess.
During your interviews, what did you talk about the most?
So the first question usually is, tell me about yourself. So the doctor would usually ask you. So I knew I had to make my tell me about myself very, very interesting. So I feel like the fact that I'm half Japanese, half Pakistani, I know 3 languages. When I tell that and I lived in different countries, that was definitely very, very interesting to the program directors and doctors. They just wanted to know what I was all about, So I feel like that was very good. And having a YouTube platform where I did what I did. Some of the doctors, they said that they watched my videos before the interview just to know who I am and how I am. I asked them whether they subscribed or not, but they didn't. So I guess I feel what made me stand out was definitely I feel like I'm well-rounded in the sense that I may not be the most academic. I don't have many researches. I'm a pretty average kid. Feel that because I have experiences in so many different things, like YouTube, I was in the football team, I know different languages, I've lived in different places. So just having all this life experiences definitely helped me out.
I think having a good CV is also very important, but at the end of the day, the kind of person you are and the kind of interactions you're going to have with your patients at that program are also very important, because the patients don't really, obviously it will impact your healthcare practice, but the patients really want a nice doctor who is nice to them and who knows how to talk to them, rather than someone who has a lot of things on their CV but can't communicate with the patient.
You're absolutely right. To add on to what you said, it's also very important. This is one thing, if I were to advise Dawites and fellow medical students in different universities as well. So one thing I believe is that medical students in general, we to get to where we are, to get through O levels, A levels, MCAT, and we most of us are this specific group of people who are relatively, if you look at the whole spectrum of people, like in business, engineering, and then medical, I feel medical students are relatively introverted. We don't talk much. Outside of medicine, we don't know much because we're constantly studying O levels, A levels. We're always studying, So I believe that to a certain extent is not good for our personality. It does not teach us the communication skills which maybe people of other fields would have. So one thing I would definitely encourage is get out of your comfort zone, do something, which different, get out of your, starting a YouTube channel for me, for example, it was definitely out of my comfort zone. No one in my family does it. No one encouraged me to do it. And I'm still sometimes uncomfortable putting myself out there. But then, I feel like, just doing that really allowed me to talk to a camera. This is something which looks like it is the future. Just learn, do different things, gain different life experiences. Don't only do things for your CV, do many other things. And I believe that all those life experiences eventually would add on, make you an interesting person. And during the interview, the program directors, they look for people who they can get along with.
Yeah.
So just learn how to talk, learn how to read the room, and have become an interesting person. So I believe that that's very important. I feel like with the USMLE boards and stuff, we start seeing patients as lab values, as clinical signs, differential diagnosis, and we sometimes forget that they're human beings with emotions. They come from a different background, they saw the world differently. So just being able to build that connection, build that trust is number one. I feel communication, taking history is a form of communication. You're just greeting is a form of communication. Your body language, how you smile, your hand gesture, everything, it's all part of communication. So I believe that it's very, very important. And it's sometimes I feel underrated. We focus so much on what's on your CV instead of how you are as a human being.
My parents, they're not doctors, and whenever they go to doctors, they have this complaint that most of the doctors nowadays are very robotic, and they will just tell you, oh, that you have this problem, but they won't really explain, because obviously for someone who is not from a medical background, they don't know what these terms mean or what kind of medicines that they're using. It's very important for the doctor to provide relief and tell the patient that this is what's going on in simpler terms and in a better communicating style. My grandfather, he was a doctor, and he used to say that once the patient walks into your room and talks to you for the first time, half of his illness should be treated just by your smile,
Exactly.
by the way you're talking to the patient, because that is your job as a doctor. It's not only to write medicines or a prescription and just send the patient home.
Communicate. If you can communicate, if you can if like I feel that's very, very important, and it's very underlooked. It's not focused on, so you're absolutely right.
After your interviews, what was the match day like?
Like it's not, I don't have like it wasn't it's not it's just that leading up to the match, try to if you have Google Chrome, you have 20 tabs open. That's usually my mind. And the match thing, I try to keep it at the very end. The X becomes so small that you can't close it. It's there, but I try to keep it in the back of my mind. So it never showed up in my how I am in daily life. But that being said, it used to show up in my dreams at night that I used to have negative thoughts.
Yeah.
Oh, I didn't match. So that was like the whole month. Everything's out of your out of your court. It's no longer in your hands. When I left it to Allah, and on the day of the match process, I think it was like 6:58. I was on the computer. My sister was like, let's make a reaction video. Let's make a reaction video. But I'm like, no, I don't want to. Like, this is my moment. I want to keep it for myself. I'm not gonna publicize it or whatever, whether it's good or bad. And I remember 6:58, 6:59, I received the email. I saw the notification pop up, says congratulations. That's when I knew I matched. So it's just like a huge weight was off my shoulders. My parents aren't here in Karachi right now, they're in Japan. So the first thing I did, there's a 4-hour time difference, so I called my mother up. She was awake. I told her that I called my parents, and I just told them that I matched. They were very happy. Yeah, so that it's like there isn't much of a story. The huge weight was off my shoulders. I feel like when I found out I matched, I was finally able to take a deep breath. The past years of like the past couple of years, I don't know, ever since USMLE, you start studying in fourth final, you think about it since second, third year. So it's like it constantly haunts you. It's always there. It's always there in the back of your mind, whether you're actively studying or whether you're not. It's just there. To finally get rid of all of that, to be done with the exams, and not having to worry about whether I match or not, whether I gave the interviews well or not. It just, you finally can breathe. Like, I feel that was just very, very relieving. When I was entering the match cycle, I made an active decision that I will not be posting anything online. I had Twitter. I don't use Twitter that much. I just made it because I just wanted to be up to date with everything. I made this active decision that I do not want to I don't want to post anything. It's already hard as it is, and I don't need extra accountability. It's my journey, and I want to just take it all in by myself. But what I did do was, during the journey, while I was going through it, vlogged explaining how I feel, the uncertainties. And then I said in that vlog that I am only uploading this vlog if I match. So right now I was just randomly watching, and just it's like I didn't make it for the world to see, but just going through what I was feeling, I was watching it by myself. I was like, oh wow, this was me 1 year ago. And I'm just glad I documented it. Feeling down or something, I could always look back at this point in my life. This is what I was feeling.
Yeah.
But now I'm here, so I should be content. And it's just, yeah.
Alhamdulillah, all of it worked out in the end, and now you're going to start your residency, inshallah. So that's really amazing.
Inshallah.
Do you have any advice for medical students?
One advice I would have for them is like, I think like once you get into medical school, something which is very, very important is decide very early what you want to do. Like make up your mind. I've seen so many students who are in their third year, fourth year, final year medical student who are still confused. I understand it's a tough decision, and but I feel like it's very important to decide early on what you want to be doing, whether it's a USMLE, whether it's PLAB, or whether it's FCPS. They weigh down the pros and cons, decide very early on. So I feel that is very important. And specifically, if you get into USMLE, USMLE step 1 is pass fail. So I feel because it's pass fail, I was interacting with a few Dawites who are in their fourth year and they're done with their step 1. Yeah. I was done with my step 1. And I think the trend when it was in pass fail was that IMGs would give their step 1 maybe in final year or in after 1 year after graduation, 2 years after graduation. That was the trend. But because it's pass fail, students don't have to work as hard to pass. So they're giving it early on. So that just increases the competition in the sense that everyone would have a fresh year of graduation, which is one thing which is looked at. So I would definitely say that, okay, decide early on what you want to do. And if you decide you want to do USMLE, then give your step 1 as soon as possible. Don't get confused with the resources. I know there are overwhelming, large amount of resources available online. Just experiment with all of them, decide early on what you want to use, and stick to it. Stick to a plan. Know who you are. You should know who you are by third year, how you study. Are you a video person? Are you someone who takes notes? Just figure out the best ways, decide what's best for you, and get done with things on time. Focus on research, focus on starting something, doing something different, stand out. If you can't stand out, be good at something, be a part of something. Yeah. I feel that's very important.
That's great advice. I think that brings us to the end of our conversation. It was an honor talking to you because I have been following you since the past, I think 5 years now. I've never imagined that I will be talking to you like this. I hope that a lot of people will find this very useful. And thank you so much for coming. I hope that we can have you again on the podcast, and good luck for your residency.
Yeah, thank you so much. It was a pleasure being on this platform. I love what you're doing. Keep it up. It's good to see a fellow Dawite doing something on YouTube as well. And I really hope anyone who watches this, they get something, positive out of it at the end of the day. So thank you so much.